Sanger Heart and Vascular, which we call SHVI, really started as the Sanger Clinic by Francis Robichek, a cardiac surgeon, back in the 1960s. The clinic has grown through the years and became part of what is now Atrium Health within the Advocate Health system as the Sanger Heart and Vascular Institute.
We provide the full breadth of cardiac surgical services, including obviously the basics: coronary artery bypass grafting, valve surgery, in addition to complex aortic surgery, arrhythmia surgery, and we have a growing and robust transplant program as well as a mechanical circulatory support program. So full service across the spectrum, complex adult cardiac surgery services.
Our Perfect Care initiative is an organized approach towards the objective of how can we deliver what we know to be the best in terms of care to all of our patients throughout all phases of cardiac surgery, including post-operative phases and the phases after patients leave the hospital.
To talk about Perfect Care, we really have to go back about 20 years of what I would call analog era, where we started thinking about teamwork, performance, reliability, that sort of thing. And then as we entered what I would call the digital era more recently, we started adding technology to leverage rare talent that we had here in Sanger Heart and Vascular Institute. And then Perfect Care specifically was a grant from the Duke Endowment, about $1.11 million over a 3.5-year period.
We have been on the process improvement journey at Sanger Heart and Vascular for over 20 years. 6 years ago, we took that quality initiative to a different level when we implemented Perfect Care Improvement Network. It is a quality initiative across all phases of care within cardiac surgery. And what we wanted to do was look at each component from the patient's journey to see what are quality elements that really impact the overall program and outcomes of these patients.
Perfect Care is a comprehensive quality program that we embarked on several years ago, and it's helped us achieve exceptional outcomes in cardiac surgery. Cardiac surgery foundationally starts with excellent technical surgery, which we have historically provided here at Sanger. What we were missing was the whole package, and that includes preoperative elements such as patient selection, risk mitigation, mitigating stroke risk, atrial fibrillation risk, prolonged ventilation risk, standardized protocols, preoperative standardized protocols in terms of how patients are managed with ERAS elements. Additionally, we have a heart team where we rigorously apply these principles to patient selection. We're very focused on providing them with an outstanding technical operation, but following that we have standardized protocols, not just for their ICU care, but for their floor care post-operatively as well. Then finally, one of the more innovative aspects of Perfect Care is our remote patient monitoring program.
The remote patient monitoring program was launched in 2019, and since then we have now enrolled over 2,500 patients. Patients prior to discharge are given a digital health kit that helps us monitor their steps, their blood pressure, their weight, as well as for certain patients a pulse oximetry to measure their oxygen. The goal is to prevent patients from having to be readmitted to the hospital, and so they are followed virtually through a cardiac surgery nurse navigator to monitor their data and biometrics and follow up with them on a weekly basis for 90 days.
My role as a cardiac surgery nurse navigator is receiving a referral for a patient and reviewing their history, ordering any appropriate diagnostic testing that we would need prior to surgery. And then once they are discharged, we would enroll them in Perfect Care.
The Perfect Care model allows a nurse to connect with them virtually once a week or more if needed to make sure that they stay on track. So we're monitoring their demographics and their vital signs and checking in on them regularly so that they feel comfortable and confident at home in their post-op care.
These are evidence-based protocols that were developed over the course of multiple years. The entire package itself has really resulted in top decile outcomes for our program. Our patients are happier, our patients are doing better, and that's everybody's goal.
The future of the Perfect Care initiative is both scale across the Advocate Health system as well as refinement of some of the processes. So I think there's a long sort of rich journey ahead of us, incorporating new tools and personalizing the care to extend the great work that we've done in the past.
We have incredibly talented, dedicated team, from our physicians, our APPs, our nursing staff, those who work in our operating rooms, those who work in our cath labs. The results are the dividend of the construction of the team. And at the end of the day, that's what we're here to do. We're here to take care of patients.